So our agenda today, we have, I'm going to talk a little bit about um, some of the recent dental clinic access work that I've been working on, but the main event today is the guest, Rachel Grimm, who's here to share an IEC, from IEC to share a project that I've been involved with on an advisory panel for the last year and a half on developing access tools for dental clinics. So Rachel is the expert on that, and we'll jump into that probably in about 5 or 6 minutes here. And I also want to say this is the last workshop of this series, and I wanted to say thank you to all the participating clinics, and I really appreciate your time and your interest in this project. So next slide, please. So this is just a reminder what we do as Disability Network. For those of you in Michigan and beyond, there are disability networks locally that provide a wide array of service and can support you in serving your clients with disabilities. Next slide, please. And then I just wanted to talk a little bit about some recent work that I've been doing locally in Washtenaw County with a couple different dental clinics. So we have done a walkthrough looking at physical access, both in the building, parking lot structure. There were questions about strategies and patterns for restriping to allow safer access to the clinic. We also talked with the clinic about transfer protocols. So for patients who are wheelchair users, sort of how they could go about developing transfer protocols for folks to move from their wheelchair to the dental chair, and then working as well with those clinics on processes for assessing patient access needs, and then looking at draft web form questions and appropriate wording for those web forms. So again, we are happy to work with any and all of you on clinic accessibility, both physical accessibility, digital accessibility, and so forth. Next slide, please. Okay, I think we can switch. I want to, while you switch to the IEC slide deck, just want to introduce Rachel Grimm, who is one of the leads on this project. And the funding came from Delta Dental Foundation. This is a national group that has been working on developing accessible dental care tools, especially for patients with intellectual and developmental disabilities. So without further ado, I'm going to introduce Rachel and bow out for it.
Great. Thank you so much, Will, and thank you to this group for having me. I'll have you go to the next slide, please. Perfect. So Will gave you a little bit of information about the Institute for Exceptional Care, but I'll elaborate just a bit. So IEC, like Will said, is a national nonprofit, and we partner with people with lived experience of IDD, family members, and healthcare professionals to change the way that healthcare is taught, delivered, and paid for. And how we do that is by creating tools, programs, and different campaigns. And through a couple of the tools you'll see today, we aim to equip all healthcare professionals with the confidence and skills necessary to deliver high quality, person-centered care. So I'll have you go to the next slide, please. Okay, so I'm sure as you've talked about, in addition to the growing population of people with IDD, this particular population is living longer than ever before, usually expected to outlive, their own parents, where many years ago that was not the case. And, as you see in the middle, we've identified, healthcare is failing people with intellectual and developmental disabilities, and for a number of reasons. But despite that, we're seeing a lot more training opportunities, and, particularly we're here to talk about dental, and these trainings are coming from, NYU, UPenn, University of Michigan, and the niche curriculum from the American Academy of Developmental Medicine and Dentistry. I'll
We're hungry.
Next slide, please. Thank you. So I'll go over a little bit of our toolkit purpose and overview, and this will be pretty much the rest of the slide. So this is a web-based toolkit with individual downloads for each tool, or we plan to do like a bulk download of all the tools at once. And the intent is to provide or to improve for provider workflow. We want to do this by supporting both providers and the patients. And you'll see in a minute or so, but each of the resources of this toolkit flows with other tools. And often you'll see, in the completed toolkit, within each resource, it references some of the other tools. So we wanted to make sure it has a particular flow and that there's a consistency and that there's all of these are really have a practical application to the day-to-day practice for both clinicians, but then purposeful for self-advocates as well. And next slide, please. So our advisory council that Will mentioned, he's been a part of, we began, in early 2024. And the first thing we did, but apart from deciding which tools we wanted to create, was create this dental workflow. And we wanted to cover each individual step that a self-advocate, care partner, and clinical professional would take through a dental appointment, from the moment they get a referral or decide they want to go to an appointment all the way into the billing and administrative tasks. So you'll see that we came up with each of these steps that we felt was a strong basis for then going in and identifying what was missing in available information for providers, self-advocates, care partners that we then wanted to create. And next slide, please. Okay, so the first tool, and you'll see a toolkit overview that says patient communication tools. So by the end of our creation, this toolkit is going to have about 14 or 15 tools. We're going to try to split that evenly between patient or self-advocate specific forms and then clinician specific forms, as you'll see on the next slide. So this one is a patient accessibility needs form. And with this tool, we want to encourage, comprehensive conversations about the support needs of the patient. And this can be used, with office staff, the dental clinicians themselves. And, it's meant to be that pre-appointment planning so that we can have a successful appointment. And you'll see just a snippet of it on the side. We begin with physical accessibility needs. We go on to touch on communication accessibility needs, emotional and sensory needs, and then any additional accommodation that the self-advocate, care partner, or guardian would like to share with the office and make them aware of. Okay, I'll go on to the next one. And this one is one of our strongest so far out of the beta testing that we've done. So as you'll see, this is a dental professional specific tool. And we wanted to touch on support roles and decision making. A lot of these tools we wanted to make as actionable as possible. There are some that, we have one called, best communication practices, and that takes practice, right? To have patience and, listen. It also goes into insurance needs and things like that. This one is very actionable, can be done by anybody in the office. And with this tool, we wanted to help the office understand, different types of people that can aid a patient during their appointment. And in the rest of this tool, we go on to help, this first page, number one, is understanding the support roles and the legal limitations of each of those. We then go on to identify the decision maker. We give scenarios as well to help, or little vignettes to help anybody who's reading the tool kind of comprehend, what questions to ask and maybe what are responses that you'll get from someone you're speaking to. We touch on supporting your patient's autonomy, setting boundaries with authoritative non-legal support persons, defining and documenting the support person's role just for your records. And then we touch on a few other role-playing decision-making scenarios. And let me just make sure I got everything. Yeah, and that's it for this tool. I will go on. I actually ran this faster than I thought, so we have a lot of time for questions. But Access Smiles, I wanted to talk about is the broader overview of our dental programming. And so the toolkit sponsored by Adults Dental that I've talked about is, a piece under that umbrella we've called Access Smiles. And this one, as you'll see here, is 4 main objectives. We want to create materials to help dental practices serve people with IDD. Recommend a series of trainings for dental clinicians on how to better serve, again, people with IDD. We want to recommend supplies and equipment for dental practices. And again, specifically can be for IDD or people with disabilities, but in, overall would benefit, the general population as well. And then finally, we want to work on scaling adoption of these resources to dental practices nationally, through as many partnerships as we can help. And I believe that's it. And then next slide, I just want to thank you, Will, for inviting me. Thank you to CDHW. My contact information is here if you'd like to reach out to me directly. And I'm happy to take any questions or.
Hi, this is India. I wanted to say thank you so much, Rachel, for joining us and sharing the toolkit, but then also some of the points about the information that you just shared at the end. Andy, could you go back to that? Oops. I was going to ask if you could go back to the slide for, I guess, Access Smiles.
Yes.
One second.
Sure. Could you tell us a bit more about that? I was curious to know about perhaps some of your national partners who are involved in Access Smiles. I wanted to know perhaps how some of us on here in this group or CDHW or our partners could possibly support these objectives in either creating materials or organizing some way to share the information so that people that have IDD and their caregivers know that these things are occurring and available.
Absolutely, thank you. So I'll cover first how to get involved. So we're currently going to begin beta testing 7 of the tools, 2 of which I've showed you here. And with that, I'm going to create just a very quick survey, and with the hope that anybody who's quote unquote beta testing these tools will use them in their practice. We'd love for both from a self-advocate care partner standpoint. But the reason we kind of split it into 2 is that, of course, we'd love for offices to keep these tools in their, available for their patrons. So if, someone with, disability or new patient or someone who has been there, but maybe you don't know everything about them, this is a new tool, specifically, let's say the patient accessibility needs form, that you could give to a self-advocate or, caregiver guardian, and to learn a little bit more about them, to make, I mean, dental care, I know, can be very uncomfortable for a lot of people, and sometimes myself included, right? This isn't, limited to, like I had mentioned before, the IDD population. And so it very well could be, could help a lot of people. So from that immediate standpoint, if you're interested in helping to beta test, please email me, or India, if you want to collect names and share it with me, however we want it to work. I'd love to have you involved in that. And for future projects, so we were actually grateful enough to just receive a grant from CareQuest. and that is going to fund a mouth body course. So what we're going to do, and specifically related to IDD, we're going to do an environmental scan on the current, materials that are existing about, the mouth body connection, how overall whole health and dental health, really impact each other, specifically in persons with IDD. And then we're going to create a 90-minute CE course it'll be a dual credential. So, both dentists and clinicians will give the same, or excuse me, will take the same course and receive the appropriate CE credits for it. And I see a question in the chat. I'll get to the dental supplies in just a second. But some of our other partners, with that, I had mentioned CareQuest. Of course, Will had mentioned Delta Dental. Michigan and New Jersey are the two specific Delta Dentals that funded this toolkit. We have other partners, like AADMD that I had mentioned, Pacific Care Dental Foundation. They're mainly based out of Arizona, but I think they have some offices kind of sprinkled around nationwide. And then finally, for the recommended supplies and equipment for dental practices, we're partnering with Henry Schein to do that. And the idea behind these, supplies and equipment, we wanted to create, a tiered recommendation list. So, from a Toyota to a convertible and then an Aston Martin on the different levels of, if you have $50 to improve your office and you want to purchase something that could help, any minority population, we would have a list of, lower cost items. And then second tier would be a little bit, more costly, maybe a few $100s, things like that. And then, the Aston Martin, quote unquote, of those would be, a Weir Child tilt, right? It would be, some items for an office that do cost, a lot of money, but, would ultimately benefit, again, more than just, this one population. So let me go to the chat and make sure I answered your whole question, Dr. Blockson. Do you give a brief description? Did that answer your question? Okay, great. Thank you. And so that's not available yet. We're just beginning that project, but by the hopes of, we're aiming for end of 2026, but we should have information before then on, different processes. And, but like I said, that one's just beginning, but we're hoping that very soon we can start to give some recommendations overall. And then last thing, so for number 2, you'll see, of course, creating materials is, this toolkit that I've presented on. Number 2, recommending a series of trainings. We're working with a separate advisory council, different from the one that Will is on. And we are having these group members go through an existing environmental scan of materials that relate specifically to excuse me, I just had an email come in and I just got distracted. Specifically related to IDD and dental care. And so these are CE courses, they're academic articles, existing toolkits, maybe they're social stories. And we're having the advisory council review each resource, do a survey on them, and we're creating ultimately this dental training pathway that'll be on our website and available hopefully in the new year we're aiming for. And what this will do is be kind of an existing list of, in a perfect world, the courses and the articles and everything you can read that will help someone who's never treated a patient with IDD or disabilities before. They can start, from the top of this training pathway on what is IDD. We go from, into a little bit of diagnostics, and then it would get into specifically, from the dental discipline, exactly how to work with patients with IDD. And ultimately, again, there's CE trainings and different things attached to that as well.
Great, that is helpful. This is India again. I was wondering about the IDD advocacy organizations. The center works with a number of partner groups that represent those that have IDD and their caregivers and family members. And I was wondering, do you have any, would you mind sharing any of the names of the groups, or if they're individuals, of course, not specific names, but I was just curious about who was involved with, with reviewing the information or providing input in addition to those that work in the dental space.
Yeah, absolutely. So all of our advisory council groups are split into, as evenly as possible, self-advocates, care partners, and then clinicians of any sort that's related to the discipline we're working on. So, we mentioned dentists, we have hygienists working on that as well, and then self-advocates, using their lived experience, and then of course care partners. And with these training pathways, we're not excluding information that's specifically for, self-advocates or care partners. We're creating sort of like a complementary list of, here's a list of trainings, that are more medical based and specifically for clinicians. And here's some complementary materials that they can then either take to their office with them, or care partner self-advocates on the same site can look at, these resources and understand how to make their own appointments, go a little bit more smoothly as well.
Thank you. Well, go
Yeah,
ahead.
this is Will. I guess what I wanted to say too is to follow up on what Rachel was just saying. As a member of the advisory council for this particular project, I was very impressed with the mix of individuals. As Rachel was saying, I think, and they did a really nice job sort of bringing together both, self-advocates, family members, and dental practitioners, and really sort of over the last year and a half, kind of sustaining and supporting that group and carrying the process forward and producing tools that I think are pretty valuable. And then I also had a follow-up question for Rachel that came up at our last meeting. If that's okay, if I can ask that.
Absolutely.
Yeah, so the question came up regarding, I know a couple of the clinics that are in this CDHW project are do medical care as well, or associated with medical clinics. How relevant do you think, and how usable do you think sort of the forms and tools that are in the toolkit might be to a clinic that provides a wider array of services than just dental services?
Yeah, thank you, Will. The goal with tools like this, we want to be able to adapt them. So IEC has 5 main focus areas, dental being one of them. We have primary care, emergency medicine, behavioral and mental health, sexual and reproductive health as well. So the goal would ultimately be to create, tools such as, similar to the ones we're creating for dental right now within all of those other categories. They wouldn't be exactly the same. And there might also be existing things out there, right? We always check first. We never want to reinvent the wheel. But to your point, Will, for like an immediate application, something like the support roles and decision making, like I showed today, even the patient accessibility needs form, it definitely does say dental on it at first, but it can be adapted to really any discipline, or an office, like you said, that has more than just dental. So some, while they will be specific, the ones that we could produce that are, pictures of procedures or things like that, maybe plain language summaries. Ultimately, there are tools that are more general that can pass between all the disciplines.
Thank you for sharing that. Rachel, I would like to take this offline and continue a conversation with IEC and CDHW.
Oh, we would love that. Yes, thank you.
Hey, I just had a quick question, Rachel. When do you think, I'm looking on your website and it looks like there's handouts. about like daily care basics and like brushing and flossing trackers with like really great kind of like icons and stuff like that. When it doesn't look like I can click on it to print it, do you know how we're able to do that?
So they're not available publicly yet. We're hoping, so in the beginning of the new year, like early 2026. Right now, we're still in like the beta testing. We want to get one more round of
Okay.
feedback before we publish the first, 7 tools. So we'll have that in the.
Do we just keep on checking back in on that website, or how do we know when they've come?
We can have you, I'd love for you all to join our newsletter. I can put our website in the chat, just so everyone has it and you can sign up right there. That's probably one of the best ways to stay up to date with what we have going on. And if you also email me directly, I'm happy to email you exactly when it comes online too. So you can be
Thank you.
the first to know.
And this is Will. I think also there are opportunities to become beta testers as well. Is that correct?
Yeah, absolutely. So if that's something that you're interested in, I would love for you to reach out to me or let Will know, and yeah, we could definitely make that happen.
Thanks.
Thank you, Catherine. Were there any other questions or comments for Rachel? Well, I have a question for the dental cohort. In addition to Catherine, are there others who will find this information helpful in your practices? And if so, like what, I know this is just a high overview, but what do you see being perhaps the most useful in your work to help with the largest or greatest challenges right now?
This is Miriam. Sorry,
Yes.
I really appreciate the like the forms and papers for preparing for the patient's visit. I think that would be very helpful in our clinic. Sorry, I have an echo. I'm not sure.
No, thank you. That's really
But I
helpful.
appreciate that.
Okay. And Sam said same here from Vina. Okay, that's great.
Wonderful.
All
Hi,
right.
India. I have a question. Rachel, if you can, do you know if there is a difference or any specifics that you could share in regards to the training that are different from some of the trainings offered, say, at Penn State, and the NYC clinics in regards to the disability training that some staff have taken in terms of what you offer?
No, so these toolkits are different in the terms of I'm not exactly familiar with the specific Penn State or NYU specific teachings, but the toolkits are meant for like an everyday use. And did you mean the future mouth body course that we're creating?
Yes,
Or any?
yes, the ones that you are going to beta test.
Yeah, so these are the tools like the ones that I showed you today. So they're just for everyday use, again, to hand out to self-advocates, care partners, any guardians, but then for the office to use themselves. I'm not familiar if NYU or UPenn has their own. I don't think so, but if they do, I would love to see them if you can share.
I've attended
sure.
trainings at those two locations.
Okay.
A lot of the training is more of your details related to your caretaking of the patients and then also how you communicate with the caretakers. I think the forms, they do give us, information that share with you that you should utilize forms. They do give you some templates and some, samples. And they advocate for you to, incorporate your own ideas, things of that nature. So I think the tools that you shared today are very helpful. But then a lot of the experiences that I personally had at those sites were related to patients that were younger or children. Some of the patients were adults that were, say for instance, maybe nonverbal or they had a little bit different of disabilities. So I think that if there's an opportunity for providers to kind of get an idea of a more general consensus of things that we see on a day-to-day basis in our clinics. We do see some children, but we do also see some adults, you know, that are maybe have a disability such as Parkinson's disease, or they may have inability of neck movement and posture and things of that nature. Just more helpful ideas of how we can incorporate those types of things when we are treating the patients.
That's really helpful. Thank you. I think we first start off with like that patient accessibility needs form. And so another tool that I didn't show today is, you know, how to ask your doctor about their accessibility features. So first step would be, you know, like fill out a form like that one and understand yourself, you know, what do you need from a dentist office? And then, you know, it doesn't give an exact script, but it gives you an understanding that, you know, of questions to ask, so that if, you know, the doctor that you're going to or dentist, you can't meet those needs, then you do have to, you know, find another one. But I think those are good starting points for tools like that. You know, if someone wrote down on the patient accessibility needs form, you know, that they have limited mobility in their neck, you know, then you would, you know, however long it takes, you know, from the submission of the materials, you know, up until their appointment, exactly, you know, how you could address those things. I will look into, we've partnered with NYU before, and I can reach out to Barbie and see if there are any specifics like that that they talk about within their course that they think would be beneficial to share. But it is also unfortunately difficult to cover, you know, every single instance that could happen. But I love the idea of kind of collating a list of things that you all go through when treating patients. Like you said, from pediatrics to adults, that would give us and the advisory council a better idea of what to put within this toolkit, not only, but in future trainings or any other materials, external materials that we find.
Thank you. Dr. Blockson, were you referring to were the trainings with NYU specific to dental, or were these broader for people with disabilities?
It was for people with disabilities, but it was specifically in the dental clinic.
Okay, thank you. All right, well, we are coming to the end of our time. Are there any final questions for Rachel or Will regarding the dental clinic, or Will and disability network services or resources that are available? Okay. Kim, did you want to say any final words right now?
All right. Did you say Kim?
Yes. Did you want
Sorry.
to say anything to close out?
No, just it's great to see everybody. And we're looking forward to seeing many of you on November 3rd here in East Lansing at Safety Net Healthcare Connection. So, and continuing this work together with the University of Michigan, I'm sure we'll be reaching out to all of you to learn more about how we can do a better job or continue this good work as we offer these grants again next year together. So stay tuned. And yeah, thanks, Rachel, and thanks, India, Dr. Mead, and Will, and everyone here. Actually, it's been fascinating. I've learned a lot through this series.
Wonderful. Well, I thank you all. Please email me directly regarding your contracts. And Rachel, I will follow up with you offline. And Will, we appreciate you as always. One last thing, if Melanie could stay on for 1 second, or please text, or please review the chat. I sent a message to you.
Okay, I can stay on.
All right. Thanks, everybody.
Thank you so much.
Well, bye.
Bye.
Bye, everyone.
Thanks, Will.
Bye-bye.
We'll be in
Thank
touch.
you. Yep, be in touch. See you, Rachel.